My name is Mike Billingham. Paul Stone has asked me to say a few words about his new PCP program. A couple of years ago, Paul came to me and asked me to design the program for him. As you might imagine, it's an extremely difficult undertaking. I didn't feel qualified to do it myself, so I enlisted the help of Jody Lemasurier, who is a capable educator. She's got a master's degree in adult education and specializes in effective educational techniques. With Jody's expertise in education and my expertise in pre-hospital care, we designed a hybrid program that is fun and engaging, as well as extremely effective, and tends to get people job ready in the quickest time possible. The profession can be very demanding. In some situations will seem insurmountable and overwhelming. We'll help you to break down the call, establish priorities, and master each one of the sub-skills, and then finally put them all together so that really you can tackle anything. To be successful as a paramedic, we believe that you'll have to become expert at certain skills. So we'll spend a lot of time helping you properly assess subtleties in changes in physiology that might lead to underlying disease. We'll show you how to properly oxygenate and ventilate a patient. We'll show you how to start an IV and become expert at it. We'll show you advanced airway adjuncts such as the King airway, show you how to properly insert it. All of these things we believe you can do ahead of getting out on the car, you can do in the classroom, become extremely proficient, and then when your patients actually need these advanced skills, you'll be absolutely ready to perform them with no hesitation and no errors. One of the other key skills, core skills for PCP paramedics to learn is effective oxygenation and ventilation techniques. To have a more lifelike mannequin to learn how to do these maneuvers is critical. You'll see here that this EC grip will facilitate placement of the mask on the face. And then the other key concept is to be able to time these ventilations with the patient's respirations and not overventilate. So it takes a lot of practice. And then in a mannequin scenario like this, we can add distractors for the student that will help them to be more job ready. So in some situations, even with perfect technique, you just can't make the chest rise and fall on its own. In those situations, it's best to establish a two-person technique. In fact, two-person technique is really the gold standard, especially in cardiac arrest management. You can see how easy it is to make the chest rise and fall. Another critical core skill for PCP paramedics is the insertion of the King airway. As with most things, it takes a little bit of practice. And by using a high fidelity mannequin, the students can achieve success much more quickly.